Hello dear students and welcome to this channel. In this video we will talk about opioids and their mechanism of actions. If we start with what pain is, it is defined as an unpleasant sensation that can either be acute or chronic, and it is a consequence of complex neurochemical processes in the peripheral and central nervous system. For the treatment of pain, it may depend on the specific type of pain, which is either nociceptive or neurogenic pain. For example, with mild to moderate arthritic pain, which is a nociceptive pain, non-steroidal anti-inflammatory drugs are effective. While for neurogenic pain, drugs like anticonvulsant, which is like pregabalin, or amitriptyline, which is tricyclic antidepressant, or serotonin norepinephrine uptake inhibitors like duloxetine are more effective than non-steroidal anti-inflammatory drugs. And for severe or chronic malignant or non-malignant pain, opioids are usually the drug of choice. Opioids interact with G protein coupled receptors, which is mostly three receptor families. The first one is mu receptor, the second one is kappa receptors, and also delta receptors. All these three receptors inhibit adenyl cyclase, and they are also associated with ion channels. So they increase the postsynaptic potassium efflux, which is the hyperpolarization, or reduce the presynaptic calcium influx, thus inhibiting neuronal firing and transmitter release. Morphine is the major analgesic drug which is contained in the crude opium, and it is the prototype for strong agonists, and it has a high affinity for the mu-type receptor. While codeine is found in the crude opium in lower concentration, and it is less potent than morphine, making it like the prototype for the weak opioid agonists. Some of the effects of morphine include analgesia, which is the relief of pain without the loss of consciousness; euphoria, which is a powerful sense of contentment and well-being. Also, morphine causes as a side effect respiratory depression. It also has antitussive properties with depression of cough reflex, but codeine is more involved with this. Meiosis and emesis are also the effects of morphine. The main therapeutic uses for morphine include analgesia. Also, it is used to treat diarrhea because it can cause constipation. The effects of morphine also include cough relief. That's why it can also use for this purpose, but widely codeine is more used for it because it has greater antitussive actions than morphine. Morphine also can be used to treat acute pulmonary edema as intravenously because it relieves the dyspnea caused by the pulmonary edema. And it is important to mention here that morphine can cause physical and psychological dependence. Meperidine is a synthetic opioid which can be used for acute pain. And its mechanism of action is that it binds to opioid receptors, especially the mu receptors, but it can also bind to the kappa receptors. This drug is not recommended for long-term use due to its active metabolite normeperidine, which has significant neurotoxic properties. Methadone is synthetic oral effective opioid, which is its action are mediated by the mu receptors, and this drug is also antagonist of the N-methyl D-aspartate receptors, and because of this it is useful also in the treatment of neurogenic pain. So this drug is used as analgesic, nociceptive, and neurogenic pain, as well as in the controlled withdrawal of dependent abuses from heroin and morphine, because it causes a withdrawal syndrome that is milder than that of other opioids. Phentermine is chemically related to meperidine, and it has 100-fold the analgesic potency of morphine, and that's why it is used mainly for anesthesia. And it is usually administered as IV, or epidural, or intrathecally. Also, it has oral transmucal preparation, which is mainly used for treatment of the cancer patients with breakthrough pain or who are tolerant to opioids. So fentanyl is more potent than fentanyl, while in the other drugs, which are the alfentanil and ramifentanil, are less potent and short-acting than fentanyl. Oxycodone, oxymorphone, hydromorphone, and hydrocodone are all synthetic derivatives of morphine and codeine, and they are more potent than morphine. That's why it is used to treat in moderate to severe pain. Codeine is considered moderate to low agonist, and the analgesic effect of codeine is derived from its conversion to morphine, while the drug's antitussive effect is due to codeine itself. So codeine is much less potent analgesic effect than morphine, while it has a good antitussive activity. And the drug has a low potential for abuse than morphine. And drugs that show mixed agonist-antagonist effect are pentazocine, nalbuphine, and butorphanol. These drugs, they activate a receptor, but they block another receptor. Like they act as an agonist to kappa receptors, while they act as a weak antagonist to at mu receptors, mu and kappa receptors. Mu and delta receptors. And they are used to relieve moderate pain. A drug that acts as a partial agonist is buprenorphine. This drug acts at the mu receptors, and it acts like morphine in naive patients, like patients who did not take any morphine before, but it can precipitate withdrawal symptoms in morphine users. And it is majorly used in opioid detoxification, and because it has less severe and short duration of withdrawal symptoms when it is compared to methadone, which is also used for opioid dependence. And other drugs which are used for as opioids are the central acting analgesics, which bind to the mu opioid receptors. These drugs are tramadol and tapentadol. These drugs are used to manage moderate to severe pain. Opioid antagonists, they bind to the with high affinity to the opioid receptors, but they don't activate the receptor-mediated response. So for patients taking opioids, they rapidly reverse the effect of the agonists. Examples of opioid antagonists are naloxone and naltrexone, and they are used to reverse the coma and respiratory depression of the opioid overdose. Mostly naloxone is used because naltrexone can cause hepatotoxicity. Thank you for watching. Please don't forget to subscribe to this channel.